I represent Mission Matsqui Fraser Canyon, which is in the Fraser Health region. In British Columbia, the most deaths from opioids took place in the Fraser Health region. In 2022, 680 people died in the Fraser Health region. Since the implementation of the decriminalization policy of this government, those deaths have only increased. But I have a very specific question today for the minister. Part of the agreement when the government decided to decriminalize hard drugs in British Columbia was that schools and places where children frequent, that there would be enforcement and that the policies of decriminalization wouldn't apply. A week after this government decriminalized, my son's daycare had to be shut down because people were injecting illicit substances and leaving that behind. I couldn't take my son to daycare that day. He goes to a school in downtown Abbotsford. So my question to the minister is this: what policies have been put in place to enforce areas where children frequent to ensure that they're not exposed to illicit drugs? We are normalizing illicit drugs in this country, Mr. Speaker, and I want to know what the minister is going to do to stop that. Thank you.
The Honourable Minister.
Well, I thank the member for the question. I also I'm pleased that he recognized that in the agreement for the Section 56 exemption, that it is still not okay to actually use drugs in the playgrounds or the places near schools. Many municipalities are looking at expanding that with their bylaws, but at the moment that is still illegal. And so what we're also saying to the member is that a lot of the deaths in the Fraser Canyon and all over the country are actually not with the people who've been using drugs for a long time. Construction workers. I was at the Carpenters Union in Nanaimo, where they're in Victoria, where they're actually handing out naloxone because they are losing loved ones on the work site because of the poison drug supply. So I want the member to understand that people are using alone, dying alone, and we actually have to have policies that will prevent those deaths.
The member opposite just said in her speech that we need to help keep people alive until they're ready to receive treatment. I represent the Fraser Health region. We had the highest number of deaths caused by opioids last year, and we're on track to pass that number again. Under this policy, it's like death has become normalized. So part of the member's speech, I agree with it, that we need to have a comprehensive approach. But right now in British Columbia, Mr. Speaker, there is no comprehensive approach. In fact, in the Fraser Health region, there are only 8 detox beds. What we've done in Canada is normalize the use of hard drugs without providing any option or capacity for people that want to receive care to get it on demand. Why has this government failed to provide detox beds in the areas of Canada where there is the highest number of deaths caused by illicit opioids?
Honourable Secretary Parlementaire.
Thank you, Mr. Speaker, and I thank my colleague for his question, and my best thoughts are with the people of his riding. There are several ways to help drug users, and if we want to keep people safe, supervised consumption sites and overdose prevention sites are part of the solution. They play a significant role in saving lives, and almost no one died of illicit drug poisoning at these sites, and we are there, and we will move forward with the opening of others.
During today's debate, the Liberals have been conflating safe supply and safe consumption sites. They're two separate policies. The reality is that the member opposite from Brampton Centre just cited, well, safe consumption sites save 46,000 lives. Well, if anyone who spent some time on the downtown east side or in the Fraser Health region, in my community, which has even higher overdose death rates than they do in Vancouver, know that someone who receives an overdose could receive good care from there, but that's not preventing them from accessing and using fentanyl and other illicit drugs in conjunction with the free drugs that they're getting from safe supply providers. If these policies that this government is pushing so hard were so good, why do the death rates continue to increase in my community? Why do the death rates across British Columbia continue to increase? And why have the death rates continued to increase since this government decriminalized fentanyl? Thank you, Mr. Speaker.
The honourable member for Brampton Centre.
Thank you, Mr. Speaker. I like to thank my colleague for his question. Harm reduction is a major concern here, and evidence-based strategy is a major play in here to save lives. We know in prior to 2015, we did not have safe spaces, but with this strategy, we have more safe centers where, a harm reduction and assistance being provided, and so we're saving life by doing that.